started. Before getting started, I would just like to set a few protocols. We would have this session in three parts, wherein Dr. Dinakar would present his presentation here. And also, we would make this session a little bit more interactive with polling and questions to the end. So let me introduce Dr. Dinakar, who is a psychologist by profession, and he's made it his life's mission to ensure that awareness is raised on all mental health care as such. So he has trained over 600,000 participants with over 6,000 training sessions. So without much further ado, I would like to hand this stage over to Dr. Dinakar. Welcome, Dinakar.
Okay, thank you, Suhas, and good evening to all of you for joining me on the session on COVID-19 past, present, and future. And to add on to the introduction, just a quick thing, Suhas was stressing on I'm being a psychologist, but I'll tell you, I'm an MBBS graduate, and later on I was working in Fortis Hospital as the head of the ICU, and then I did my post-graduation in accident and emergency care and in disaster management, and then my master's in psychology. So if you ask me what I love to do, my passions are like I prepare organizations for the emergency response, be it fire, be it a first aid or a medical situation, or even a disaster. And we are talking about COVID-19, and it's comes into the category of a large-scale disaster. So I thought we should connect to understand about this. Before I start off, adding to the guidelines what Suhas was saying, I request people to be on mute during the session. We'll have time for Q&A, and we are going to have a kind of a poll question happening in the last. So request all of you all to be on mute. If you all have any questions, you all can always ask at the end of the program. The second point is, I would request you to be safe during the training, in the sense if you're driving, please stop your car, be in a safe zone with parking lights on to attend the training. If you're driving, see that you're safe. I don't want people to walk around and attend the training, because if you're walking up and down the stairs, you might have a trip and fall. So be seated ergonomically well and safe, and do join the training. So what are we talking about in this training? So normally when we think of business continuity, the pictures which we always focus is, we always think about a flood, earthquake, a terror attack, political disruption leading to strikes, or disruption in normal life. But not many of us thought that a kind of a disease, a viral disease, could take such a big toll and disrupt our life for almost a year. Okay, of course, pandemics do happen, but we always saw it in history, and now we are living with it. Okay, so this is one big challenge which came to us, and it is a lesson which we have learned. There were a lot of mistakes which happened, but then for all our team members sitting in this training, it is definitely a lot of takeaways from here. Okay, even me being in the emergency field, okay, we were totally stressed out the whole year and trying to support our clients in handling the COVID-19 situation. We did fairly well, thanks to all my nurses and the ambulance crew who are there at the sites of the companies and the corporate sites. Most of them even did not take any kind of holidays. They were working 24/7, and they did a fantastic job. So I would say my team members really did a great job, and we had a lot of psychological stress happening in us. But having said this, we are going to understand what are the contents of the program. We have 45 minutes of talking, and then it's going to be a Q&A and poll. So let's quickly get started. What are we going to learn in this program? So what are the lessons learned with this COVID-19? What did we really learn? What are the plus or the pros and cons of this situation we faced? How was our response? How are we going to improve our response over here? Did we take care of our organizations and their families, or did we educate the families? And a lot of questions were asked about the immunity, the treatments, and the vaccines, which I'm going to answer over here. So let's understand about this virus. Yes, it is a new virus. The COVID-19 is a new virus. If you ask me what are the old viruses, then you know very well, common cold, or we call it as the flu, or the simple flu, or the common flu. Most of us would have faced a common flu in our life, and most of us never went to the doctors, right? So you had your friends and your family members telling you, take some kasaya, take steam inhalation, apply some amrutanjan. Some guys would have told, take dolo. And your near and dear friends who are very close to you would have told, take a peck of brandy and you're out with your common cold. So in 7 days, any of these treatments used to work for us when we got a common cold. But we are talking about a new virus over here, which was much more serious. It was infectious, and it started affecting all the organs. Now, that was something very, very dangerous. We started off with the lungs, and then the COVID-19 actually, totally shut down the oxygen system of our body, and then caused multi-organ failures. Now, that was something serious about this COVID-19 we learned. So it was a new virus for us. We are just learning about the new virus. And yes, the virus is mutating. All viruses do mutate. Even the H1N1 virus mutates. So we had 3,000 different variants of the COVID-19 from different studies. Can you believe that? But not all of them were actually dangerous, right? And we are still finding better methods. We are finding better treatments. We have definitely improved in the way we have managed treatment plans for patients, and we have a clear picture of how to handle the situation. But the mantra for all of us and for our organization still remains the same. Though vaccines are running over there with their schedules, though we have improved on our treatment plans, the mantra for all of us is still remains the same: not getting infected or not infecting others. So we have to still follow that. So I know most of you, all the managers sitting over here, you will have questions from your employees or from the team leads asking you, when are we going to start up with the vaccination program, when we are going to take off this mask, when the sanitization and all these uh, things related to COVID guidelines are going to stop or end. Okay, fine. We are going to slowly stop it over time, but we should be sure that most of us have a very good immunity. And yes, we have a very good plan to manage anyone who gets an infection. Okay, so till then, it is still the same procedure we are going to follow. So, what are the lessons we have learned over here? One of the important things which I feel we missed on is treating the spark period. If you remember, in December 19, we were getting information about something going wrong in China. There is a virus which is as an outbreak. So we thought it something like it might be confined to only that region. We thought it might be something like a rubella virus, or you would have heard of some Zika virus. So we just thought it's going to be there only in China. But over time, we understood that there were a lot of deaths, there was a lot of infection being spreading out. So we should have taken that spark period and planned ahead, which actually, if you ask me, being from a disaster management perspective, it did not happen well. So we should know that it might be happening in any other part of the globe, but we have to start preparing over here. We should have had our rehearsals happening over here and taken it seriously. You won't believe it, some of the organizations did have their pandemic management training in November and December 2019. There were organizations which called me and conducted the pandemic management training over there. And that time the employees were asking, this is too early, y'all are over, you're blowing it out of proportion. Okay, one. But that training really helped that organization to understand what is a pandemic and how to deal with it. So we had a good strength of employees attending those kind of pandemic management programs, though WHO declared the pandemic later. So what I'm trying to say is, I feel it's very important to get a little bit of training happening ahead of time so that we know how we are going to get prepared in case such a thing happens. Okay, fine. So earlier communication and guidelines. We should have charted down our communication plans. How are we going to tackle in case we face such a situation? Probably we just thought, okay, let us see how it happens over in China, and then we'll probably lay out a plan over here. So some of the organization did not have an early communication plan and guidelines. To tell you a fact, we have ambulance services in most of the corporate companies, and they requested us, can you convert your ambulances to COVID response vehicles? And before they could say us or request us to do so, we had already had the sanitization devices, the COVID suits already placed in our ambulance to prepare for the pandemic. So what I'm trying to say is, if you're really planned a little more early, then you can manage your own organizations or own kind of small community over there. Documentations of data is very, very important. Now, why documentation is very, very important is it is there for us for the next learning. So always document whatever you see. You see someone having a high temperature at the entrance of your company, your nurse or the security has to document it. And next time the temperature went low, it is a learning to tell that probably because he took a hot drive in the hot sun, that's why the temperature went high. So everything, when it's documented, it really helps us to teach our team members. So during this present situation, I want you all to document whatever you all have seen, whatever you all have learned, so that it becomes a learning material for the next team members to understand. Emergency preparedness for the future. That's one thing we have learned, how to prepare for emergency. During the COVID 19, most of the companies were on lockdown, right? But when I'm asking, there were very small numbers of employees working. Mostly it was securities and the support staff team. I was asking organizations, why have the evacuation drill stopped? Why have you stopped the emergency response training? They were telling, sir, COVID, sir, we are not going to do that. But you have to run these kind of trainings because COVID is not the answer. You can't stop everything for COVID. What if you have to do an evacuation procedure during a COVID situation? So your team has to be prepared how to modify the evacuation drill procedure. How do you modify providing a first aid for someone during a COVID situation? So the first aid trainings and the fire trainings went totally low, which was wrong actually. We should have had it. You know why? Because during a COVID, how do you provide first aid treatment to someone? So our security guys or our ERT members should know it, wearing a mask, wearing the face shield, how to provide first aid training. So the thing is, we should not wait for something. Emergency does not wait. Even in the hospital, it was the same funny thing which has happened. All the hospitals became COVID hospitals. So anyone gets a heart attack, no problem. Anyone died because of asthma, no problem. So everyone got a respect only if you died because of COVID. If you died because of COVID, it was like very good. You died of heart attack, that's common. So everything has its own importance. So let us not put on all these emergencies. So we have to be prepared for emergencies. And how do you manage your organizations? Which are the areas? Where do I provide the screening area? What are the restricted zones? All these things were something which we definitely had to learn during this COVID situation. So this was one area which I found really funny, and at some point I was getting angry about it. I'll tell you why I was getting angry about it. We were trying to see how to handle situation, but there are a group of people who are trying to mislead the whole kind of information which I was having in COVID-19. So I was attending one of the a wedding which happened recently, and of course with all COVID guidelines happening and social distance. So one guy walks up to me and he calls me and asks, "You're Dr. Dinakar, right?" And I said, "Yes." He called me and he said, "Sir, this COVID-19 is some kind of a golmaal, I think." That's what he said. It's a golmaal, and you doctors are involved in that golmaal. I was totally shocked. I was midway with my dinner and I kept my plate and I told boss, "Who told you this?" And he told, "No, I'm getting information. This whole thing is a big hoax and WHO is into it." And I was totally shocked after a year of COVID and so much of stress and all the people running around. People are still thinking that COVID-19 does not exist at all. Okay, so something like atheist, like there's no God. So there are a set of people still believing that COVID-19 is a big kind of a gamble which happened, and all those deaths which happened. I don't know how they believe such a thing happened. So I'm coming to an area where some things are, really faster than the virus. I feel the rumor spread faster than the virus. I would blame WhatsApp for this. Okay, so in WhatsApp, we saw a lot of miscommunication happening. Even the news channels went wrong. So some of the news channels, I can say that they said that Italy has already got the vaccine and they have started off. This was in May 2020. Okay, got it. So someone had spread that message, and a friend started giving suggestions of the different kinds of kasayas and the lime juice and the ginger juice, and all of you started following that. I'm very sure when doctors say something, no one really takes it. But when a friend comes and tells you, please take this, you really start working on that. So we had admissions of patients. I had one patient who had taken around 8 to 9 cups of ginger lemon tea every day, and he landed up in the ICU because the whole intestine was gone. You can't overload your system with someone tells you take ginger, it's very good for COVID-19, and you end up taking that, you're gone. So you'll have to not go into these kind of myths and misconceptions. I'll tell you why. Sorry to say this, but these are the things I think so most of you guys would have heard. The lockdown which started off in our country was something fantastic. It was a great decision to be done, I believe, because in India, anything cannot be controlled. So the lockdown was, of course, it disrupted life of some people. People could not afford their daily livelihood, but then the lockdown should have been done. So once the lockdown done, the first kind of myth I heard, the shocking myth is, why is this lockdown? There are few people who are telling us that Modi has planned that everyone should stay at home, and there's an helicopter which is going to come everywhere and sprinkle disinfectant spray all over our country. Can you believe this kind of a rumor which is spreading? We hardly can spray on our hands. I don't know how he's going to spray the disinfectant material all over the country. So this was one message. The second one, when the lockdown was released, not released actually, when they told, okay, fine, certain things can happen. Again, there was a request that all of us to show the solidarity and the unity of all the countrymen. We had to come in the balconies and we had to clap. Okay, got it? So this was one thing which we had to do. Another thing which circulated in the WhatsApp. Clapping the hands is going to increase the noise levels, and that is going to create such a big vibration that the virus is not going to sustain and it's going to move off. I don't know how the virus is going to move off with the noise vibration. So believing this, a lot of people lost control. They came on the streets with plates and spoons, and you would have seen that in the video. They messed up the whole lockdown. Okay, guys came up and they started beating the plates. It became like a rock show on middle of the roads. Okay, so no social distancing, no mask. The whole lockdown went in for a kind of a failure because of this kind of a misinformation which happened over here. Okay, I feel all of us should take this seriously, because when a misinformation is spreading, we are the people, we are the business continuity heads. We have to see that we do our part by telling them, boss, this is all wrong information. So we have to do that so that at least we control our sector of people who believe in us. Okay. Coronel was one medicine which was released by Patanjali telling that was the treatment. Later on, when the medical council hit it, they pulled it down. Someone said the vaccine is found. And yes, the worst thing which I heard is the coronavirus is not a virus at all. So this is one area where I feel we should actually help people understand all these kind of facts. Okay, got it? So it's not wrong. It's not wrong. You tell who's going to ask me if you want to know the actual facts. We have to know that. All of us are using the infrared thermometer now on a hand. You go to a shopping mall, it's used on your hands. It's not used on a forehead. It's used in your hands. Why did this happen? Hitting the infrared thermometer is not going to harm your brain. That ray is not going to go and puncture your brain and then you're going to, that's it, you lose your memory. It's not going to happen like that. The fact is, it's your temperature going towards the device. It's not that the infrared ray is going to go and spoil your pineal gland, and these were the informations. So once that rumor started spreading, it came up from the forehead to the hand. And in a few days, some guy is going to tell, once you hit on their hands, your hand is going to become paralyzed, and then we have to find another zone to hit the infrared thermometer. So we'll at the end of the COVID-19, we would have bought almost the whole area of our body would have been hit by the infrared thermometer. So what I'm trying to say is, we guys have to go with facts, and everyone turns to us and asks us, is this true or wrong? So we have to have our documents ready and our support, and we have to tell them to go to reputed sites and check these kind of informations. Now, this is one thing. The first thing is, it was a challenge for most of the organizations to protect the employees. It was a tough call. I know employees started demanding us to provide an insurance for COVID and provide a little more top up on the insurance cover for COVID. You would have all faced it. All the managers will agree to me. Second thing, employees started asking us, can you provide COVID support to our families also? So the demand went on increasing, and now I know all the companies are facing the next kind of a demand where employees are asking, can you provide the vaccine for me and my family members? Next, it will go to neighbors and next street people. So people will start demanding things. So how do you handle it? An organization should support the employee first, okay, and then it is the employee's duty to support his family or take care of his family. So our job should be to give very good awareness for the employees. Okay, so we have rolled out virtual trainings for most of the companies and the employees, and we have made the employees sit with their families to understand about what is COVID-19, so that we encourage the employees to understand this and take off the fear. So rather than employee going and telling his family what the doctor said, the whole family is sitting for the training and understanding what we are trying to say. And all the Q&As were solved over there. So the first thing is the employees have to know who's the risk category over there. So most of the employees started telling that I have an old father at home, I have an old mother at home, my mother is a diabetic, and my father is a diabetic. Actually, they are not going to get COVID-19 because they are not stepping out of home. It is you who are going to go and give the COVID-19 to them. So the employees had to know that they were the risk factor. It was not their fathers or mothers. So everyone used to call me and tell, sir, my father is diabetic, my grandfather is a heart patient. So who's going to get the infection home is you. They are not going to move out and carry the infection. So most of them did not understand that they were the key people to get the infection back home. So we have to, work on those critical lines to understand the family members. What is the risk category? Who shows high risk behaviors? See, as adults, we know we have to wear the mask, we have to sanitize our hands regularly. But when you take your kids to a supermarket, do you think they are going to do that? They are not going to do that, right? They'll be touching every object in the supermarket. They are not going to sanitize their hands. They are not going to, wash their hands regularly. So what I'm trying to say is there are certain areas which every employee had to understand. Okay, and we had to get that awareness and see that every employee protected his own family and see that the infection does not spread into his family. So we had to work on that. So that was one area. So let us not restrict any kind of an issue like a pandemic only to the employee and stop it over there. We have given the employee. So a lot of companies did this. They gave a kind of a kit, a COVID kit to their families. They gave COVID kits where they gave masks, they gave sanitizers, they gave a thermometers to the families. That is a job fantastic. I'll agree to that. But have we provided awareness? That's the question I will ask you. So have we provided awareness? You can give the kits, but the skills had to be added on to that. So we have to add on to that skills to that. So how do we provide them with the kits, the healthcare numbers and information? A lot of information poured in the WhatsApp, but half of them were hardly any helpline numbers. Some of them did not work. So we have to see that everyone had to get connected and where they have to reach for some kind of help and how to use the PP. You won't believe half of the people did not know how to wear the mask. You got it? I'll give you a very funny example of my neighbor. During the COVID-19, everyone was wearing the mask. My neighbor was wearing a mask and a face shield and wearing gloves to go to the nearby grocery store. And he saw me. I was just wearing a mask. So he asked me, "Sir, doctor, why are you not wearing your face shield and gloves?" I told, "The mask is more than enough. I'm just going to the nearby grocery store." And he told, "Okay, even I'm going there." So we took a walk. And once he reached the grocery store, you won't believe it. He's going close to the shop owner and he's asking him, "Che anda de do." He's asking him, "Give me 6 eggs." And that fellow could not listen to him properly. He could not hear him properly. So he's asking, "Kya?" This fellow is telling, "Che anda de do," with the mask and the face shield on. So he could not hear it properly again. So my neighbor got a little frustrated. So he removed the mask, he pulled off the face shield, and he went very close to him and he told, "Give me 6 eggs." So understanding the story over here, this guy goes all the way with the mask and the face shield and finally breaks everything over there. So most of us did not know when to wear the mask, when not to wear the mask. You'll all agree to this. You saw mask. Most of them were here. Most of the mask was here. Okay,
டாக்
got it?
எங்க கிழிச்சுது அண்ணா?
Okay, got it. So these were situations which happened. And we had to support on immune system. So what is the kind of food we had to eat? A lot of us went up into food fads. I know during March, April, May, most of our homes would have been loaded with ginger, 1 kg ginger, lemons stored at home. So we would have done all this stockpiling because someone would have told you that taking ginger, green tea, and everything is good. Okay, got it. So these are the nutritional advices you would have got, and people overloaded and started mega dosing. Okay. So one of the best questions since this year, when I was doing a COVID-19 training for most of the companies, um, one employee asked me, I can't forget this. Okay, it keeps on running. He asked me, sir, when there's alcohol in the sanitizer and it kills the virus, can I take alcohol inside? Okay, this was his mantra. So he wants to take alcohol so that it goes and kills the virus inside the system. So basically, the concept is he wants a yes from me to take alcohol, thinking that the funda is the same. Alcohol in the sanitizer, alcohol inside. I told that guy, you can take alcohol inside, but it's not going to help you in COVID. But the only thing is, if you take alcohol during COVID, it will only remove your fear, I feel. So one or two pegs, and then you'll throw your mask, you'll throw your gloves and tell COVID aane do, main dekh leta hu. Okay, got it. So that's the only thing your alcohol can do. So actually, alcohol can decrease your immunity. So see, some of you would have got information to take alcohol, and the last area we actually suffered is the mental depressions we face. So for all of us sitting in the program, you'll tell, yes, I faced a kind of a mental stress during the work from home option. But mind you, even children face a lot of depression because they were not allowed to play. Homemakers had a lot of stress because we were the only ones who used to take them out for shopping or for a trip. So when we are not going out, even there, what the minimal going out of home actually stopped. Okay, fine. So the work from home really started off well. Okay. So I had most of so we have 850 companies connected. So a lot of IT employees were really happy in the start. They were telling, sir, it's work from home option, sir. We have to stay at home. We are not going to go to our offices. And I told, so then what about your systems and connected? They told, sir, everything is got home. One boy gave me my laptop. He provided chair. They gave me a table. So everything is at home, sir. I need not travel. And the most happiest guys were the guys working in Belindur area, I guess, Belindur Whitefield, because their travel time was almost 2 to 3 hours. So they were very happy. But I told, yes, work from home is good. And they were telling, sir, we totally enjoyed this, doctor. It is really nice. But I tell, yes, but it should not be for a very long time. I think so. You should be going to office. They don't know, no, sir. This is paka. This is perfect plan. And everyone is a little happy during that work from home option. Now, in the last few months, I'm getting calls from employees telling, sir, when can I go to office? I want to get back to office. You know why? Because that stress is building up. One employee was telling, sir, every day it's meetings and meetings. I have to get up, take my shirts and keep ironing them and keep them ready in the hanger, take my shirts, iron them. I told, what about your pants? He's telling, sir, pants is not required, sir, for work from home. It's only the upper part which is very, very important. So guys were preparing like this for the work from home. So what I'm trying to tell you is, initially everything looks good. Now employees are calling and asking, sir, when do I get back? I want to meet my friends. I want to socialize. I'm missing my chai time with my friends. Can you understand what I'm saying? I'm missing my lunchtime walk around the campus of the building. So there are employees who are facing that stress now. And this is going to be the next pandemic. When COVID-19 is going to stop, or when it's going to be under control, we are seeing a mental pandemic which is going to rise. We are going to see people having problems with adjustment. Just think of your kid going back to school. He's going to have a big problem with the adjustment. If you have not trained him, if you are not, he or she is not trained to follow the daily routine, our kids are going to have trouble when they get back to school. It's going to be a little trouble for us. Employees, if you have not followed your routine, like getting up the same way as in your office and following your routine, then we are going to definitely have a tough time in office. So we are looking at the mental stress which might pop in, and that's why we are providing a lot of psychological support to the employees over here. Now, coming to the next one, a lot of confusion again over here about lab treatments. What is the best stress and what I have to do? the best test we had to do, which is still the best test, the gold standard test, is the RT-PCR, which amplifies the genetic material of the virus. So if you have the virus in you, the RT-PCR will tell, yes, boss, you have the virus. There are other tests like rapid antibody and the other chest X-rays and CT scans, which help us in telling us whether the person might be having a COVID infection, and it just gives us an idea of the stage he's in, whether he's critical or not. Okay, got it? But if you ask me to just find out which is the best test, go for a RT-PCR. So if you go to the airport, if you're traveling, you know very well, they ask you for a within 72 hours RT-PCR report, because that's the gold standard test, which tells whether you have the COVID-19 infection or not. So I think so you guys should be clear of which is the best test to find out whether you have COVID-19 or not. Now, if you want to find out the next one, if you want to find out, say in your company, you have 100 employees and you want to find out how many employees have got COVID infection, they have already got COVID infection, or they have still not got COVID infection. Now, that's where an antibody test comes into play. So if you want to know the immune status of your organization, it is the antibody test which can be helpful for you. So I've been recommending that. See, RT-PCR. Now, I'll just give an example. Sorry to just take Suhas as an example. Now, imagine Suhas, Suhas Shastri, I do a COVID RT-PCR test for him today. Okay. Tomorrow, he might get the infection. So he's only valid for today and for a few hours, that too few hours. So I stamp a seal and tell Suhas, you are COVID negative. But at 8 o'clock, he can meet someone and get an infection from some other person. So next day, if he comes into Gorisco, just giving an example, he is a COVID positive patient. So understand the different tests. As a doctor, I'm trying to tell you, don't blindly start connecting to any lab guy and tells, sir, RT-PCR is the best. And you start rolling out an RT-PCR test. So it's a very costly test. Now the rates have reduced, but you have to know what kind of test you want. What are you trying to study for your organization? Whether you want to just screen them or you want to know the immune status, who's got an infection, we will help you on that. And we will definitely reduce the cost levels. Don't blindly start doing some tests just because in the Google it's given this is one of the best tests. You might require different kinds of tests. The BBMP was doing what is called as the rapid antigen test. You do the swab and within the half an hour they used to give you the report, right? So that is called the rapid antigen test. The accuracy is only 30%. So you have to understand that. Whereas the RT-PCR is almost 90 plus. It has a very good kind of sensitivity. So you'll have to know the different kinds of tests. Now treatment can be done at home, guys. You don't have to go get admitted in the hospital. Even if you have a senior member at home, keep them at home, have all the basic equipments. There must be all these equipments at home. If you have not got it, I want you all guys to keep it. You should have a thermometer at home. You should have a pulse oximeter at home. You should have had a steam inhaler at home to take steam. Got it? Have your BP machines at home and have your glucometers at home. These are all things you have to keep, guys. Almost, okay, that's the fact. So in this 1 year, you should have done a short-term MBBS course, actually. Okay, you guys should have called me and told, sir, I know what's the saturation, I know what's the BP. This is the time where you could have another 1 year of pandemic. I will see Dr. Suha's clinic somewhere in Bangalore. So what I'm trying to say is, you guys had to learn it with us and you could have helped a lot of people. Okay, so a lot of people could have learned a lot of things, okay, with these kind of supports. And you go only to the hospital when it's a challenge, where you feel the person's having breathing issues and all these kind of things. Otherwise, it's not required. Okay, so this was actually a plan layout which I had put during the situation where people were not getting hospitals, where they were not getting beds. So I told them how to work on these plans. Do you know how many hotels were converted to COVID centers? Not many people actually knew this. Otherwise, you would have gone to a hotel and stayed over there, and the doctors and nurses would have treated you over there. But all of us believed that we had to only rush to a hospital, which was the next mistake we did. Okay. This is one point which I want to say, though most of you might be non-medical people, understand the COVID-19 is not just a respiratory disorder. This is one message I want to give you. Most doctors might have not spoken about it. So don't think everyone who comes to the hospital will come with cough, sore throat, fever, body pain. Wrong, you're wrong. I have seen COVID patients coming with stroke as the first symptom. Stroke, you know what stroke, right? We call it as lakwa. So person came with a crooked smile, with one hand not moving properly. And later on, they said, sir, around 1 week back, he had a sore throat and cough. So that was the COVID-19 infection, which has disrupted his blood mechanism, clotting mechanism, and he's ended up with a stroke. So this guy has come with a stroke to the hospital, and the history told me he's a COVID patient. So then later on, when I did his COVID test, he was a COVID positive patient. So please understand, you will have people with very different kinds of symptoms. So I have people with diarrhea and vomiting coming, no sore throat, no proper. So these are the asymptomatic cases. So please understand, these are things which happen. So don't treat COVID-19 as just a respiratory disorder, though most of us had sore throat, fever, cough. Of course, the very peculiar kind of thing which COVID-19 showed us was the loss of taste and loss of smell. I think so some of you would have had that. That's what really irritating. Okay, so these are the points you'll have to know. And the long-term kind of symptoms which patient had is fatigue. They had, even after the COVID goes off, people still have all these kind of problems. So people who had got COVID-19 and recovered, they had a hell of a lot of problem telling that, sir, I'm feeling very tired. Okay, I'm not keeping well. So these are the kind of symptoms we face, and rehabilitation is very much necessary. Just because you became COVID-19, that does not mean you're out. Your lungs have to improve, so you have to do breathing exercise. You have to get back to this. Now, the challenges for the organization. Now, let's see what are the challenges for the organizations we had. We had challenges of screening for a COVID suspect and denying entry. So when the organizations are going to open, we are going to start off in small numbers. I know most of us are thinking of opening an organization in small numbers. How do I do a screening of a COVID suspect? I know most of you all are having a security guards, having their thermometers, but trust me, you require a paramedic nurse. Okay, we are providing paramedic nurses to do the screening. It is not just the temperature. It's not just the temperature. There are a lot of questions we have to ask. And sometimes people would have had some kind of symptoms in the past, or the person who gave that infection would have had symptoms, and the guy entering in an organization might not have any symptom at all. So I feel a paramedic nurse, we train all our paramedics to do the COVID screening, and what are the questions they have to ask, and how they work with the company to deny an entry. It is not that my nurse is going to tell, get out of the campus. He can't do that, right? So we keep them in the isolation center, and then we call the corporate security or the admin and tell them, sir, we suspect that so-and-so might be having a COVID-19 infection. So if you all are planning to open up your organizations in small numbers, have a very good plan of how you're going to have a kind of a small medical setup. It's not going to cost us much. Have a kind of a setup and see how the nurse can take over and handle that situation. A security guard is going to have a tough time. He has to have two things. One is he has to understand how the machine works. He has to take care of the entry of the other people. So it's going to have a tough time. And sometimes he might not make the right decision of whether to allow the employee or not. The usage and disposal of PPE is very important in organizations. The medical waste load increased around 4 times in Karnataka, 4 to 5 times. Can you believe that? Because of the mass. So it was a total stress on the hospitals and the biomedical waste, and they made it more strict that biomedical waste normally is every 48 hours, but they told hospitals to clear it every 24 hours because of the amount of biomedical waste which was generated. Can you imagine nurses throwing off a coverall every day? Every nurse throwing off a coverall every day. So can you imagine the amount of load we had of biomedical waste? The same thing applies to you people. So make your revamp your biomedical waste system in your organizations. That's very important. And try to see that how you can maintain your transport and cafeterias. These are areas where you have to really be checking on. And do you have healthcare centers support close by and also within your organization? We can create a very quick healthcare support system inside your organization. All we require is a room or a kind of a setup near the entrance, and our team can really work on. One is how to do the COVID screening and how to prepare for emergency management. And you all have to have an emergency management, not only for COVID, also for fire during COVID, first aid during COVID, and try to restrict the zones in your organizations. You all have to restrict zones because the more you let the employees move on the campus, you're going to have more trouble. So you have to restrict the zones in your organizations. And how these are all the challenges we have faced. And if you are going to open your organizations, you have to have a tick mark. You all have to have a complete rehearsal of how you're going to handle all these areas before we actually open up our organization. We are not going to do any trial or error after the employees come into the organization. That's going to be bad. So we have to be prepared how we are going to handle this before they come back. So if you see this hierarchy of COVID-19 control, what I'm trying to say is, if you see the administration, everyone plays an important role. But finally, what I'm trying to say is, it's to eliminate and substitute all these kind of situations. And the PPE is the last thing we are looking at. See, we always stress on masks. We always are going to shout at employees and everyone, please wear your mask, please sanitize your hands, social distancing, you have to shout. But the thing is, that plays a small role over there. The major thing is how we as an administration or a group try to control the employee. Because I'll tell you what's going to happen. An employee might wear a mask in front of you, but he might remove his mask and throw it on the desktop or a table when you're not around. If that's going to happen, that means our way of communication has actually failed. An employee should be responsible, not only in the office, but also at home. So if we have done that, then I think so we have done a great job in controlling the situation. So the prevention for the future is, of course, vaccines. Proud to say that we have done a good job. India has done a good job. Though our vaccines were condemned globally, now everyone's actually using our vaccines. Okay, though they were telling our efficacy, our effectiveness of the vaccines. So as a doctor, go for the vaccines. Okay, it's really safe. I have given it for all my staff members, and it's really safe. And we are still going to look at early detection and treatment. Okay, so whenever we are seeing, so anyone has cough, just don't leave it. Follow the same. Of course, the fear is gone, but then the guidelines should remain the same. So follow it up. You can't tell, sir, it's no more COVID, sir. You have to still follow it and follow the guidelines. Even if your employees are coming back, the employees might argue with us telling that, sir, no one's wearing mask. I have taken my vaccine, so I'm COVID free. You'll have all these answers coming up from the employees, but you're going to put it straight at the entrance that we are still following our COVID-19 guidelines. So we have to be strict. So one guy, so tomorrow an employee is not wearing his mask and you go and ask him, why are you not wearing a mask? The answer you're going to tell is, sir, I have taken my COVID vaccine, sir. Double dose. He'll tell you all those kind of statements. Okay, got it. One guy will tell, I've taken all the types of vaccines, sir. No problem. Okay, got it. So you'll get all these kind of answers coming to you. You are going to still follow the guidelines and show as an organization that you are still the same till the picture is absolutely clear for all of us. So preparation. So once employees start coming in, please understand, we have to prepare our emergency response plan again, whether it's a COVID infection, whether it's fire. I'll just give you a simple information. In fire, all the employees have to move out. They have to walk down the stairs. The rule is holding the hand railings. You remember there's a rule about holding the hand railings during an evacuation. Now the question is, during a COVID situation, do the employees hold the hand railings or do not hold the hand railings? Because we are the ones who told them, do not touch surfaces, right? So there's a confusion over here. But actually the truth is you have to hold the hand railings even during a COVID. You know why? Because if he's not going to hold a hand railing and telling, sir, COVID-19, he's going to slip and fall down the stairs and break his head. That is going to be more serious. So we have to, the employees have to hold the hand railings, come to the safe assembly area, and there will be sanitizers over there. And that fellow has to sanitize his hands and go and stand in the safe assembly area. Just giving you one modification in the emergency response preparation plan for all of us. So let us prepare for all these zones. Okay, got it? So that's it from me. Thank you very much. I know I went a little bit into Suhas's time for polling and Q&A, but then Suhas is quickly going to roll out a polling for you so that we'll have a look at that and we'll see how much we learned. And then it's going to be Q&A. Suhas, over to you, Suhas.
Thank you, Dr. Dinakar. That was a very fruitful session, I must say. A lot of myths and stories that we've heard so far, which are actually true. And you have helped us demystify those myths and ensure that the awareness is there among our participants today. And I'm sure that they will spread this across the organization that they work. So I'll quickly run the poll to ensure that we have the understanding from the session today. So I will give about 15 seconds time for you to respond to the poll, and the answers will be given right away. So please let me know if you are seeing the poll questions on your screen. Okay. So please respond. Yeah. Okay, I'm closing this within the next
Okay.
okay. So we have 87% saying RT-PCR is the right test. Yes, the session we said RT-PCR is the right one. So we'll go to the next question. So please post your voting. Okay. We have close to 60% of the votes which have come in. Okay, I'm closing the poll now. You should get your answers right now. Okay. Okay, we have an interesting response here. Okay, hope I'm audible.
Yes, Vas, you are.
This is okay, I'm stopping the poll. Okay. You've got your responses here. Hopefully that's the right response.
Yes. Never underestimate a soap and water hand wash, please. Okay. It's very important. If you have soap and water is good. Sanitizers is only when you don't have soap and water with you. Even a water, just water, you wash well, it works. I seen some people just, using the sanitizers everywhere. Okay. Because you keep it in offices everywhere, right? So each fellow, whenever he sees the sanitizer, he keeps putting it like some tirtha, no? Where you go to temple, you take it. And for some fellows almost, cover up their whole body with that. Okay. So it's just 1 or 2 drops, guys. You don't have to use much.
Okay.
It's become a status quo now.
So Harsh, we are not able to see the results when you finish the poll.
Okay. Thank you, Daman sir. I'll just check that out. So we are going to the fourth question. You're able to see the question.
Yeah.
Okay. I will stop the polling in the next 5 seconds. 4, 3, 2, 1. Okay.
This time we could, yes.
Okay. I will go a bit slower on the showcasing the results as such. So we have 85% saying that it means slow the spread of the virus and to reduce the peak number of cases. So we've got that right. So we'll go on to the fifth question. So we've heard about a lot about herd immunity. So what is it? So let's see how much of us know about herd immunity. So I'll stop this in another 5, 4, 3, 2, 1. Okay. Are you able to see the results?
Yeah.
Okay.
Yes, boss.
Please keep telling us what's the correct answer also.
Yeah, that's the one. You all are going great. You all are giving the correct answers.
Okay. So to the sixth one, can COVID-19 be cured? So this is an interesting question. So that's in my wish list. So we got 60% of the vote so far. So I'm closing it in 5, 4, 3, 2, 1. Okay. And share the results.
Okay.
So doctor?
Hot drinks came closer here. I feel everyone got the wrong information about the hot drinks over there.
We'll have to define what is hot.
Yeah. What is hot? Okay. So for me, it looked like coffee and tea. I don't know how it looked for others. But anyway, as I was saying, any of these are just going to help us, but they are not, they're absolutely being a cure for the COVID-19. Okay. So answer the orange one was right, actually. The orange one, which most of them are what.
Okay. Thank you, doctor. So the seventh poll. So it's a critical meeting. So we got only 40% of you have voted. Okay. Okay. We got 80% now. Okay. 5, 4, 3, 2, 1. Okay.
Okay, this went a little wrong, guys. Okay, actually it's outdoors. Okay, try to move outdoors. Don't sit in a closed room. The virus can, infect easier in an indoor kind of a setup. So if you really want to meet up your teammates in the office and it's something quick, try to move to the outdoor zones, probably in the open areas, because even a slight breeze or anything can move the virus. So the answer here is outdoors. Remember that. Okay. So
Yeah,
first of all, I know very well that it should be virtual, like what we are doing now. But in case you want to meet up on 6, 7 guys, never keep it in the meeting room. Move out, come to the open area and have a chat with social distancing. That should be the best thing. Okay.
Okay. So I think the results were shown a little bit late now. Okay. So we have 50, almost 50-50 here.
Yeah. It's outdoors is the answer. Okay.
Okay. So we've got a few people asking, saying that there should be a third option called virtual.
A virtual. That's why I just put it as the term. I put it as a critical meeting where you all guys are there in the office and you all are in a COVID-19 situation and you all have to meet up quickly. Yes. So virtual is the best. That's what I said. Virtual is the best where you have to meet face to face. Then this should be the option. Just move to the garden area. We are doing it. So I'm right now having certain emergency procedures which has to be explained. Then I keep it in the garden area or the open areas of the organization.
Okay. Now we have the next question. I'm holding my breath just to ensure that, just to check if we are getting the right answer here. So, okay.
It's tricky.
Okay. So 5, 4, 3, 2, and 1. I am ending the poll.
Okay. Hey, this was another funny thing which happened. I know you would have got it in WhatsApp where a dot keeps rotating on the square and they tell you hold your breath till the dot comes back to the end of the square. It has to travel. So actually my wife was trying this out. I told you won't know, your internet might be buffering and you'll be holding your breath for a long time and it'll be good news for me. So don't don't go for all these kind of tests here. I know it came in the WhatsApp where one dot keeps rotating and you have to hold your breath. Even a person with illness can hold his breath for 10 seconds. Please understand. Sometimes the normal guy cannot hold his breath. It's an individual threshold. So the answer is a big no. Don't go for all these kind of tests.
Okay. We'll come to the second last question. What is more important for preventing infection?
We don't have an option of both.
No, you can choose which you feel is better. So we can see that, right? Which is better? Which you think is more important? The question is which you feel is more important.
Okay, we got close to 70% of the votes. So 5, 4, 3, 2, and 1.
Okay, again here it's the other way around. It's actually your hands. You'll have to be more worried about your hands than the mask. Now I'm wearing a mask. I go to a get together, but my hands are infected and I put my dirty hands on the mask or into my mask, it's gone. So it's the hands which actually carry most of the virus and you keep frequently touching your face. Okay, so concentrate on frequent hand washing, guys, because the hands is an area, this is the culprit which actually keeps touching a lot of surfaces. And that's how you spread the infection more. Okay, so concentrate on this. Okay, so hand washing is important. Wearing a mask, yes, but frequent hand washing is more important. Okay.
Okay, thank you, Doctor. Coming to the last polling question. Okay. Does isolation and quarantine mean the same? So we have close to 60% of the responses so far. Okay, 5, 4, 3, 2, 1. Okay, interesting responses.
Okay. So the difference here is very simple, guys. See, quarantine is just that keeping a person away for 14 days. You know what's quarantine? You're just suspecting might be the person was along with the COVID-19 patient. Isolation is you have a high suspect or your report is positive. That means you have to keep them in isolation, in an isolation hospital or there. So an isolation means you are infected. You are infected either by the lab test or by the symptoms where the doctor tells, I feel is a high suspect COVID patient, put him in an isolation area. Quarantine is just because I traveled in the same bus, same cab, I was in the same floor. That's a quarantine. So a quarantine is less severe. Isolation means the person should not be in contact with anyone at all. So isolation is more for patients. That's the message. Okay.
Doctor,
That's it.
I'm just sorry. Can I pitch in?
Yeah, please.
Doctor, I'm just a little have a query here. So isolation and quarantine objective can be different, but in terms of process, does it remain the same or it varies in terms of process as well?
The process varies, Kapil. If you ask me as a doctor, process varies. Both the guys will be remaining 14 days. Okay, right? But if for an isolation fellow to come back to work in my office, I require a little more documentation because he's a COVID patient, right? So I need a clearance from a doctor that he's medically fit and can return to duty. Whereas a quarantine employee can just come back to work. That's the only major difference over there. So you're going to take a person on isolation, on treatment and all that a little more seriously, document it and see that he reports back to work after that 14 days of stay in the hospital or at home.
Got it, doctor. Thanks.
Yeah.
I have to drop off as I have another meeting to join. Thank you.
Yeah. Go ahead.
Thank you, Kapil. We are open for questions.
Can I?
Yes,
Daman, sir.
Mr. Daman.
I have two questions, doctor. First one with bit fun. The second one is serious. The first one is, when did you get your first and second dose of vaccine and which one?
See, we are taking the Covishield, and we belong to a hospital called Purnima Hospital that's near us. So we took Covishield, and that's quite effective. Daman. Both are, whether you get Covaxin or Covishield, it is fine. It is not a major difference. I had my doctors who had taken it. And if you ask me honestly, what are the side effects? I'll just tell you, it's pain at site. Sometimes you have pain in your arm. You might have very mild fever. These are the only things which happen.
Have you taken both? That's what I was asking. Or have you taken one only?
Not both the vaccines, not both the vaccines, both the dosages.
Shots, yes. Dose, I'm saying. Yes. Right. Okay. Second question is personal. My mother is 90 years old. She takes medicines for BP, also high BP, and she has got pacemaker as well. And she is 38 kg in weight. Can she go for vaccination?
She belongs to the category of the higher age group, definitely yes. But for the comorbid conditions, I would recommend you to have a physician's opinion to take that vaccine. It's not about the vaccine affecting her, but then let him examine her, let he or she, a physician, examine her and give a clearance for vaccine. Okay, got it?
Yeah, I got it, but the question is still, in mind. Is any physician willing to do this inspection and giving that in writing?
Yes, we do it. Actually, right now we are running the vaccine for the elderly people, Mr. Daman. We are running that. And for those who are of younger age groups, actually the thing is, if they want to rush for the vaccines, they are asking for some physician's clearance. So for your mom, actually for her age category, she can go and get a vaccine done. But what I'm trying to say is, because of the kind of health condition she's having, it'll be better she gets a kind of a nod from a physician. Okay, that will be better.
Okay. Well, I see a challenge, but second challenge, it happens in India. We believe earlier, we know earlier also, but this is happening currently also, that no questions are being asked.
Okay.
A person visits just to inquire, and he gets, why don't you come and have the vaccine and go home happily? That is also happening without even asking their medical conditions.
Okay, fine. See, that's what I'm trying to tell you. When the kind of process is faster without queues and all that, I'm telling all my people I know just to have a clearance from your local physician. It can be just Mr. Daman, it can be just a phone call with your known doctor who's treating your mom. Take a clearance and move. Okay, got it? Because a vaccination camp is just to hit the shots.
Yeah.
Not to, they won't keep asking you, where are you from? When did you have your surgery? Kuch nahi puchenge. So we have to do a homework and get there.
But at that age and with these conditions, you are saying it's okay to go ahead.
Yeah, it's okay.
We were worried, and she was also worried. She was asking this question: can I bear this vaccine or not?
Okay. You have taken it. It's absolutely safe.
Thank you.
Any other questions?
Hi, Suhas and Dr. Vaidi here. Thanks a lot for an excellent session. I have one question. Now, you mentioned about RT-PCR test being point in time test. Is there any other test wherein we can see the immunity or the what you talked about, the antigen or whatever?
Yes.
Can be done so that we know the chances of a person getting the infection, so that basis which any work from office can get enabled. That could be one of the parameters.
Yes. Vaidi, I'll just tell you, we have done it in one of the companies, and that's why I'm stressing on that. See, the RT-PCR tests are costly. I'm not saying they are not good. They are costly, and they are the best to tell you whether anyone has COVID or not for that particular time. Now, right now, we have 20 participants. Just an example. If I do the RT-PCR, I will tell you 5 people are positive, 15 people are negative. That's the result. If you ask me, is this test valid tomorrow? I'll say no, it's not valid tomorrow. Tomorrow, again, you have to do the RT-PCR for all the people. Now, there is another test which I spoke about. It's called the antibody test, which is done by taking your blood samples, not throat swabs. In the blood sample, it will be very clear telling whether out of the 20 people, how many people had been infected by COVID infection, present or past. That means, did he have it recently or in the past? So if I have 10 people who had got, it has 2 readings. One is called IgM and the other one is called IgG. IgG tells me that the person had got the infection somewhere, say January or last December. Can you understand the example? So those are called past infections. So those 10 employees, I can give an immunity pass telling that these guys were already infected and now they have very less chances of getting the COVID infection again. So you can give them an additional badge, putting a green badge and letting them inside your company. I'm just giving an example. Now, if I have 5 people who have got the recent infection, which is called IgM, those are the guys who have to go for RT-PCR because I doubt whether the infection was somewhere recently. So what I'm trying to do is you're doing a double kind of testing and you're making it very clear for your organization who are previously infected and are immune, who are presently infected and who are not at all infected. You'll have a very clear category of your employees and you can run the show very safely in your company. RT-PCR is an everyday kind of a gamble. Every day you might have to spend money and keep doing it.
Okay, but sorry for the additional question. So when if someone is not infected at all, be it in the past and even currently, then the second test, what kind of outcome it will show?
RT-PCR. For those guys, you have to do an RT-PCR. I'll make it very simple, Vaidi. What I'll do is I have created a flow chart for the managers to understand how it works. So probably through Suhas or anyone, I will share it with you. You can go through it. It's very simple. Okay.
Okay.
I'll share it. Don't worry. After the program, you can take my contact. I will share it with you.
Okay.
Yeah.
Thank you.
Doctor, this is Chandana here. As per a recent study, it is basically saying that the efficacy of the Covishield vaccine basically rises when the interval between the 2 doses is increased to 12 weeks. Is that a fact or a myth?
It's not a myth, Chandana. It's one of the studies. Okay. So what I'm going to say is point number 1, believe in the vaccines. Point number 1. Of course, studies are coming about the first dose and the second dose, the booster level, which increases the vaccine. The message over here, first, I want to tell all the people attending the program, once an employee receives the first dose, that does not become he's COVID free. Please understand this. So after taking the first dose, employees will start running on the street and telling, Mera ho gaya, I'm absolutely free now, and he'll go start being very close to people. So please understand the 2 doses are very, very important as of now, according to the studies. Of course, the kind of spacing we give is to see that first an immune response is created. And the second one is always considered as a booster dose to improve the antibodies. Later on, as COVID becomes a kind of a disease which we more know of over time, you will probably have 1 dose coming up, Chandana. Probably next year, we might have only 1 dose coming up, 1 standard dose based on the studies which are just happening. And the second thing which might happen, which I feel is one of the best things, is you might have a nasal vaccine also coming where they'll just spray it in your nose. So if that comes up, that's going to give you immunity immediately faster because the antibodies start producing faster over here. Okay. So I have gone through that. It's just one of the studies, Chandana, but I can't comment right now on that because we have more journal studies about the immunity levels of the Covaxin and the Covishield. Okay.
Thank you.
Okay. Yes.
I guess we have gone 10 minutes past the scheduled session timing. So I guess it is quite successful because the moderator didn't get to ask his questions. So any more questions? We can have one final question, and we can call it a day. You can always write to us, and I believe Dr. Dinakar will be most happy to respond to those questions. Okay, I have almost 9 questions. I'll just keep that to 1, which I got a couple of things from the chat as well. Does pandemic induce PTSD kind of disorders, and how can these be addressed in the large scale because it's pandemic?
Yes. Post-traumatic stress disorders are quite common, but you normally see it with kind of accident. Now imagine I'm driving on a highway and met with an accident. So next time, whenever I'm going on a highway, I might start getting shivers, I might start sweating. So that's a kind of a post-traumatic stress disorder which happens. Can people have post-traumatic stress disorders? Yes, you can have, especially if you had any of your loved ones, you have lost someone in a COVID-19 situation at home. I feel those are the categories which might have a post-traumatic stress disorder because they are not able to take that kind of a situation. They feel COVID-19 was a virus which was far away and suddenly it took up someone from the family, right? So these kind of stress disorders are quite common to face. And that's why I was stressing on that, the psychological factors or the depressions and the mental disorders and traumas are going to be the next kind of things which are going to keep psychologists and psychiatrists busy in the coming. We are facing a lot of questions actually on that. So how do you understand it is, we are doing two things. One is we are telling people to talk to health counselors, even if you have lost someone in your family or if you have lost your friend and you want to know more, health counselors are available. Okay, there are a number of, especially in Bangalore city, you have a lot of health counselors who can help you deal with the post-traumatic stress disorders. And over time, I'm definitely going to have, we will have this, which is quite going to be active. We'll have all these kind of small groups where people have lost their family members in COVID. This is going to happen, and you can join one of those groups where you can, get some support from another family member who had a similar situation over there. These groups are going to be formed. There are some small groups, though I know about them, but these are two areas where you can get support. Okay, one is reach out to a health counselor before you feel your symptoms worsen, where you're feeling the stress over there, so that you're prepared to handle when situations come back to normal. Okay, because once situation comes back to normal, you'll still be in the same state. So we don't want that to happen. So seek help. You can always call me if you have a little trouble. You can always connect to me, or I can connect you to someone else if I'm busy. So seek help. It's not wrong. See, in our country, always counseling and psychiatry is taken that you're a mental case. This is the word they use, right? You meet a psychiatrist, you meet a psychologist, you're called a mental case. It's no more than that. Your problem might just be for a day, but you can always call up a psychologist or a psychiatrist. Nothing wrong.
Okay, thank you, doctor. And one interesting question, I'll make this the final one. There is a question which they say, okay, what is the long-term psychological effects on the society once this period is over? Will
Yes.
people forget this incident or this pandemic quickly? And how will it change the society as we know it right now? Or will we become a society which is a lot more cautious and a lot more with kind of OCD kind of environment?
See, I feel globally, especially India, no, we people like to forget bad things. So I feel we like to forget bad things. We don't want to stick on to bad things. So we will try to forget things. Everyone wants to throw off their mask. Everyone does not want to see a sanitizer around in a shopping mall. So everyone wants to get back to normal. Okay, so that's going to be the trend. No one wants to keep a sad face ever in their life, whether it is for one day or for a year. So even for the COVID, we definitely want to forget it and come out of it. That's going to be the picture over here. People want to venture, people want to travel. That's going to happen. But if you want to see the kind of insult or the kind of patch it's left in our life, yes, that's going to be something which we are going to talk about to all the next generation people. This will be one talk when you're aged and you're sitting on your deathbed. You want to tell what happened in 2019, 2020 to everyone. So that's a message you'll be giving across to people over here. If you feel, are we going to be a little more cautious? The last part of it. Yes, we are going to be a little cautious. That's for, but that will be for a selected group. So I don't think everyone's going to become cautious about it. But there will be a people who are going to be cautious, at least for the people who are attending the program over here. We guys definitely are going to be a little more cautious. And I feel we should respect what we are doing. Hand washing, we should continue for anything. Do you know how much of pollution related cases reduced this year because of the mask. The good side of it. Okay, food poisoning was considerably reduced. These were the good things which happened. Giving a message over here that the hand washing helped in other zones. The mask helps us in other zones. Asthmatic cases considerably reduced because people were wearing masks everywhere. So the message over here is, the take home over here is, yes, we want to forget this. As a doctor, even I want to throw it back. And yes, I don't want to keep warning people, remember COVID-19, COVID-19. Don't want to do this. But then there is a message. If you ask me, there is a message over here. Yes, there is a message over here for us to sit back and see how we plan for the future. And I want all of us to support our employees and our family members, our children, everyone, to slowly get back to their normal life. They definitely require our support. It's first we are seeing as how we can get back to work. That's there. But then we also have to tune our family members to get back to that normal life. I feel that's very, very important.
So thank you, Dr. Dinakar, for a fabulous session. And thank you one and all for attending this extended session today. I'm sure it was fruitful, and we have learned a lot from Dr. Dinakar. He has definitely deciphered the myths and the false analogies that goes with the pandemic, and he's presented the facts to us, and also encouraging safe habits going forward towards family as well as our employees in the organization as such. Please forward your questions to us. We'll be happy, more than happy to respond to them. And we will also ensure that, okay, in case any future sessions required, we'll be more than happy to host them for you.
Okay, thank you from my end. Before we close, first of all, thank you to Mr. Deepak and Matthew. Matthew, special thanks, because Matthew kept calling me continuously. Even though I was busy, he never let me, and he told, no, I have to call you. And he was running behind. Sorry, Matthew, because I wouldn't have been able to, pick up your calls regularly. It was a very tough situation for me. And Suhas, you finally, you got the platform ready and you hit it on the nail and you did a perfect job. So thanks for being such a good coordinator and making my job very simple.
Thank you, sir. Thank you. In fact, we need to thank you because being a very tight schedule, you were able to give us the time. So with a big heart, thank you so much. And for making the session so interesting and giving your time. Thank you so much, sir.
Thank you, Suhas. Thank you, Matthew, everyone. Thank you very much.
Thank you all. Bye-bye.
Bye-bye.
Thank you all. Bye.